Well, it's good. It's a nice group, small group. We'll be able to answer lots of questions for you. Uh, I'm a board-certified pediatrician. I've been working with children for 30 years, and something new started happening in the late 80s, and that was an increase in children with autism and attention deficit disorder and allergies and asthma, and this impacted their developmental growth. And I really got into it personally when my fourth boy, Joshua, developed autism after giving him an MMR vaccine. And my wife said, "You broke him, now you fix him." And that put me on this road to figure out what is going on with these children and how we can bring treatment interventions that can make their lives a whole lot richer. But why do we talk about autism, ADD, this spectrum of things in one kind of a talk? Because most of us think about attention deficit disorder being totally different than autism. But actually, how I look at it is how they respond to stimuli. Now, the old diagnosis of autism, which is still being used today, just basically it says it's a childhood psychosis. And the treatment is geared toward managing these mental illnesses, these self-injurious behaviors, the picking, the hitting, the screaming, the tantruming, but doesn't seem to take into account any of the underlying medical problems, the problems that as a physician I was trained to deal with. So officially, when you think about the diagnosis of autism, it's a communication disorder. There's repetitive behaviors. There's that stimmy behavior, the flapping kind of behaviors. They could be jumping, it could be vocal, but they call that stereotypy. Tantruming, of course, social aloofness, and they have some very abnormal play, ways they play. But that's not what I find all autism is. In my clinic, I see it as a problem with handling stimuli. And the stimuli can be from multiple sources like sight, sound, smell, taste. Certain things bother these children, they hold their ears. Certain things feel odd in their mouths, and so they won't eat them, so they have a very self-limited diet. I've had kids where if they put their hands like in pinto beans, it'll cause vomiting, or shaving cream. In other words, they respond to things that they feel in a very unusual way, and smell as well. Sounds can be a big problem for these kids and how they process them. Well, that's what I see also on the folks with attention deficit disorder. When the teacher is talking about George Washington being first president of the United States, fought in the Revolutionary War, married a wonderful lady named Martha, that auditory stimuli comes in, but they don't process it normally. So when they're asked next week who is the first president of the United States, they haven't a clue. They're not processing maybe one or two things not well. Autism, they're not processing things, a lot of things not well, and that's why you hear about this spectrum disorder that people talk about, ASD, autism spectrum disorder. So in my clinic, what I'll do is I'll look at this full spectrum where this child who comes into my office, nothing makes sense to this poor little guy. He's sitting in the corner, he's rocking, he's got his finger in his ear, he's biting his wrist, and he's just got his eyes closed, and he's rocking and making noises. And mom says, "I love you." Dad says, "Go get your shoes." None of that stimuli makes sense to him. He doesn't know when he's hungry or he's thirsty. Those stimuli don't make sense to him. Obviously, potty training can be very difficult because he's not aware of what the stool or the urine feels like in his bladder. That doesn't make sense to him. That's this guy. This little guy over here, we call the ADD kid, he has friends, he plays soccer, he's doing great except at school. That auditory stimuli, he can't process well, and we call him ADD, and of course they want to put him on medications for that. So then we have all these kids everywhere on this spectrum, and that's why you get high functioning, low functioning, moderate functioning, severe, and all these cutesy little words. But right here is a line. Everybody on this side of the line is dysfunctional. They are not doing well. Everybody on this side of this line, they're quirky, like their daddies, but they're functioning. They're going to do okay. So that's how I look at it as a spectrum, and that's why we hear about this spectrum disease. Now, when I look at these children on the whole spectrum, that's why I wanted to talk about everything from autism to ADD, they are also having other problems. They're having gut issues, whether it be constipation, diarrhea, abdominal pain, sleep issues, which of course can be impacted by gut issues if they're having those. They have allergies, and they could be allergic to our things in the environment, or they could be allergic to certain foods that we're giving them. Immune issues, I've had kids who've had 15, 20, 30 rounds of antibiotics because they keep getting ear infection after ear infection or sinus infection. And not once does the physician say, gee, I wonder what's wrong with the immune system. Maybe we should do an immune system workup to find out why you are so susceptible to getting ear infections. Neurologic issues, well, 30% of my practice has epilepsy. So there are definitely neurologic issues going on. Psychiatric issues, the obsessive-compulsive behaviors, the ritualistic behaviors, the habitual behaviors, the anxiety issues, the tantrums, my way or the highway kind of stuff. Endocrine issues, a lot of these kids, they have problems with thyroid gland, growth hormone, and the production of their sex hormones. They're making too much or not enough. Chronic inflammation and oxidative stress are huge in my practice. And of course, toxicity. What else is going on in our world that we're being exposed to? So, our bigger kids, of course, have bigger problems. You know, it's one thing when you have a 3-year-old who's out of control, but a 13, 14, 15-year-old out of control, that's even more challenging for us parents. They can have problems communicating, of course, and focus and concentration, ADD. So, one of the biggest issues I have with autism is they also have an ADD component, a very strong ADD component. Anxiety and obsessive-compulsive behaviors, and now they start getting aggressive. It's one thing when you're 3 years old and you're a little aggressive. It's another thing, obviously, when you're 15, and you can be quite aggressive, too. Then we get into menstruation and masturbation and all kinds of stuff. So I like to say, bigger kids, bigger problems that we get to deal with. More problems, epilepsy, diabetes, precocious puberty, inflammatory bowel disease, short stature, depression. When they start getting older, remember, these kids aren't stupid. They may have autism or they may be on the spectrum, but they're pretty sharp kids. They know they're not like the other kids, and they can actually start getting depressed. They can have intrusive thoughts, and then, of course, why they always think on the dark side thoughts.